Introduction of medical coding. Medical coding is the conversion of complex medical reports to simple universal codes. Uses of medical coding. 1. To store medical records in an easy format. 2. To globalize fee structure. How does medical coding work? 1. Medical coder review patients' records, including physician notes, lab results and radiology findings. 2. They assign unique codes to each diagnosis, treatment and services. Who is eligible as a medical coder? Should have the following requirements. 1. Education: have a high school diploma and complete medical coding training. 2. Training: complete a certificate or associate's degree in medical coding, health information technology or related field. 3. Knowledge: have knowledge of medical terminology, anatomy, physiology, CPT, HCPCS and ICD. 4. Skills: have computer data entry skills and be able to study and examine medical records.